Welcome to American Workers Insurance Services. We're going to talk about some healthcare reform facts, and this is information only. Please always review all your options with an experienced healthcare benefit specialist, and you can review all of these facts at the government website, www.whitehouse.gov/health reform/myths and facts. My name is Willie Martinez. I am the Executive Director of Marketing for American Workers Insurance Services, otherwise known as AWIS. I've been a licensed agent for a little bit over 19 years, mostly with health insurance. AWIS is a licensed and registered insurance agency and registered in over 40 states and 2 territories, and has been established since 1983 and was established back then by a group of doctors to market affordable association healthcare benefits. AWIS has an A rating with the Better Business Bureau, and we offer limited group health and dental insurance benefits, and we've been in business for over 30 years. Now, our association healthcare program is one of the 3 types of healthcare programs used today in our healthcare system. The first type is government Medicare and Medicaid, which we're familiar with. For people who don't qualify or are not eligible for government assistance, there's private health insurance, major medical HMOs and PPOs. But for some people, that can be pretty expensive as well. And that leaves association healthcare benefits. Simply put, if you're familiar with Sam's Club and Costco and AARP and AAA Club, millions of Americans join these associations to get access to their benefits. By becoming a member of our National Association of Preferred Providers, NAP, our members are eligible to purchase limited group medical, dental, and or life insurance benefits after a waiting period, and it's only $12 per year for an entire family, which is a pretty good deal. An article that just came out in January of 2013 in the New York Times stated that health insurance raised some rates by double digits. Insurance filings with the state of California, for example, in 2013, Aetna, Anthem, and Blue Shield of California all wanted rate increases of 20% or more. And this is after just a couple of years ago when Anthem Blue Cross requested a 39% increase in 2010 and was granted a 19% increase. So prices are going to continue to rise, and it's all over the country. Florida, Ohio, for example, the insurance has been able to raise rates by at least 20% for some policyholders. The rate increases can amount to several $100s a month, and under the new healthcare law, regulators are now required to review any request for a rate increase of 10% or more. Federal government estimates that in 2014 and beyond that most carriers will be requesting about a 7.5% rate increase, but it still will be going up. Now, under the benefit mandates under the law that was passed in 2010 and upheld in 2012, exchange plans are supposed to be approved no later than January 2013. And these initial plans will be available October 2013 with an effective date of January 1st, 2014. States also have the discretion to allow businesses with more than 100 employees to purchase coverage in these exchanges beginning in 2017, which is another 4 years. In addition, states may opt to allow the federal government to establish an exchange in their state rather than to implement their own. Benefit mandates for January 2014 are going to limit deductibles for health plans in the small group market to $2,000 for individuals and $4,000 for families, unless contributions are offered that offset deductible amounts above these limits. And of course, this does not include co-insurance out-of-pocket expenses. Limit any waiting periods for coverage to 90 days and allow states the option of merging the individual and small group markets. Also, to create an essential health benefits package that provides a comprehensive set of services, covers at least 60% of the actuarial value of the covered benefits, and limits annual cost sharing to the current law on HSA limits, health savings accounts, which is $5,950 a year for individuals and $11,900 a year for families. To require also that all qualified health benefit plans, including those offered through the exchanges and those offered in the individual and small group markets outside the exchanges, except grandfathered individual and employer-sponsored plans, to offer at least the essential health benefits package. The Essential Health Benefits Package must include items and services with at least the following 10 categories: ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services, and chronic disease management, pediatric services, including oral and vision care. The federal government are establishing 4 federal exchange plans. The cost-sharing features will be addressed in separate rules and will determine the actuarial value of the plan expressed as a metal level as specified in statute. bronze at 60% coverage, silver at 70% coverage, gold at 80% coverage, platinum at 90% coverage with the limits we mentioned earlier. Most people will probably not be able to afford the platinum coverage, so the majority of Americans will probably have to purchase the bronze plan through the exchange services. What happens if individuals don't want to purchase health insurance? They will have to pay a penalty tax. The first year of implementation, 2014, the tax is going to be either $95 or 1% of your income, whichever is greater. So a person earning between $20,000 to $30,000 a year, which is not a lot of money, will pay $200 to $300 per year in penalties, and that's per person. In 2016, if you still don't own health insurance, fine increases to $695 per adult, $347.50 per child, up to $2,085 per family, or 2.5% of your income, whichever is greater. Does the employer have to keep providing health insurance? For companies with 50 or more full-time employees, the employer faces a $2,000 fine per full-time employee after the first 30 full-time employees if health insurance is not provided to at least 95% of all full-time employees. And that 95% was just updated a few days ago from 100% to 95%. And folks, you're going to see probably minor changes over the next several months and maybe over the next several years. So expect there to be minor changes from time to time. Now, there is a solution to this, and this has been around for many years. For those of you not familiar, high deductible health plans as an option for small business owners have been around for many years. And that's basically a healthcare plan that charges a lower premium and has a higher deductible than traditional healthcare plans. It is usually paired with a health savings account, HSA, to provide maximum benefits at the lowest cost to individuals. Often, small business owners find that health savings accounts and high deductible health plans are a cost-efficient way to provide health insurance to their employees. Now, another of the benefits is that the sum of the high deductible and the maximum out-of-pocket expenses that you pay for covered medical expenses have a ceiling. Another benefit is that it may provide preventive care with no deductible or with a much lower deductible. And in summary, it's meant to really force consumers to save money through their HSA for medical expenses such as co-payments, prescriptions, and lower out-of-pocket medical costs. And of course, the high deductible health plan kicks in when there are larger catastrophic medical costs, which is what we're all going to want. We don't want to pay that out of pocket, obviously. Not only does this plan save the consumer and employee money, it is a cost-efficient way for small businesses to offer their employees health insurance as the premiums are lower than for traditional health insurance plans. IRS Publication 969 gives more extensive information on the high deductible health plans, HSA, healthcare accounts. Here's a couple of examples from some of my clients. I had a 20-year-old male non-smoker come into my office and was looking for a major medical plan with the lowest deductible. In other words, the Cadillac of all plans, with a copay of $25. Now, it does have 80-20% coverage, which means he'll still be responsible for up to $3,000 per year in co-insurance after he meets that deductible every year. And that's $265 a month. Now, he was mentioned to me that's a little bit more than he can afford, so we showed him the high deductible HSA, which is also major medical with unlimited insurance benefits. And this one has a $2,500 deductible with a $3,000 co-insurance. But look at the price of the premiums. It dropped from $265 to $110 a month. That's a savings of $155 per month per employee. Here's a 53-year-old male non-smoker. Offers visit copays $25 with the lowest deductible at $250, and the premium was $713 for a healthy 53-year-old. Now, a person who may be overweight may be looking at $892 a month. Now, with a high deductible HSA, again with unlimited insurance benefits, and that does qualify as major medical high deductible under the new healthcare reforms. That also qualifies under the limits established by the healthcare reform. That premium dropped to $297 to $371. That's a savings of $416 to $521 per month per employee. Now, the challenge, of course, will be that some employees won't want to pay that high deductible. That's where AWIS comes in. We can add a supplemental plan to cover the deductibles and co-insurance. The benefits include $1,000 per day in a hospital for up to 31 days per year, which is more than enough to cover deductibles and co-insurance. $2,000 per day for intensive care and critical care, for up to 31 days per year per family member. $5,000 per accident with a $100 deductible, which is enough to cover the majority of your deductible and co-insurance on your major medical. And $5,000 critical illness, which will help you if you have a heart attack, stroke, or cancer, again to offset that high deductible and co-insurance. and some other benefits, doctor visits, dental, optional dental HMO, and the hospital patient advocacy is included to help negotiate hospital bills. And other benefits are available and can be specially designed for any size company. Now, this is an example of an association plan with limited group insurance benefits that can work perfectly hand in hand with a high deductible HSA. We call this plan was particularly designed for a company that we met with recently. It's called the Med Plus 1000 2000. It's got a monthly fee of $149.95 for a single individual and $229.95 for a family. So it's very affordable. It's got a one-time enrollment application fee of $100 and the annual NAP fee of $12 a year to become a member of the association. And the benefits include, as we mentioned, $5,000 per accident, $100 deductible, $10,000 accidental death dismemberment, hospital patient advocacy, $50 office visit reimbursement, $100,000 emergency travel assistance, and that hospitalization for any reason at any hospital, by the way, of $1,000 per day per family member, 31 days per year per family member, and intensive care, critical care coverage of $2,000 per day for up to 31 days per year per family member. So it's a great supplement if you want to marry that with a high deductible plan. And if there are other options you can choose if needed. For some people who want other options, that will be available at an additional monthly cost. The dental plan is also an option, and the dental plan is the best dental plan in the country with the largest dental insurance company in the country. All active duty military members have this plan for over 50 years. No health questions, no age limits for adults, children up to age 26, and it has no limits on the insurance benefits. So that's a pretty good deal. No annual cap, and no yearly cap, and no lifetime cap. Some of the lowest copay examples you will ever see of any dental insurance plan in the country. So the cost of these AWIS Association health plans, or some people may supplemental plan, will cost less than the difference between the cost of the traditional comprehensive plan and the high deductible HSA plan. And again, these HSA plans qualify under the new healthcare reform law. Bottom line, you'll get more coverage by combining these two plans at a lower cost. We can give you a free no obligation quote. We just need a census report from your company and all the employees, a copy of any current health care plans in force, renewal date if you have any, and we can give you a proposal back within 5 to 7 business days that will include one or more options. Thank you very much and welcome to American Workers Insurance Services.